a long time, but now we're implementing it in the office because we're doing the big cases and we're doing a lot of cases. So sometimes it's a hard cases, so it's easy to do guided.
I see.
Yes.
And the good thing is that we know the density of the bones and everything inside from the 3D scan. You don't have to open the flap and gum surgery. So you can just drill it directly. So the healing is pretty faster. Put the implant same day.
Wow.
And we provide anesthesia also if someone wants to be sedated completely, just like a big surgery.
So you added all these robotics.
So we changed it. It was only 4 rooms, and we changed everything from start to finish.
Wow, that's great.
So that machine, the laser we use for sleep apnea as well. Sometimes patients
Needs let us know once we take the CVCT where everything is in space, right? Take the CVCT, we take this off.
When you go guided, right now what happened is haptics, right? Are you guys familiar with haptics? So basically, if you're going to the wrong direction, it's going to basically tell you, hey, this is not the optimal location to go. Trajectory of the implant, it's locked in. Now you press the blue pad.
Blue pad on,
Yep.
you can drill.
Yep. And then imagine this client is not paying the bills and you want to hit the nerve. Go hard, it's a bad customer.
I see.
Hopefully.
So identifying the depth, right? We know the implant we want to use, the size of the implant, so that'll help us identify.
It's on the 8 millimeters.
Yeah. So talk. So we're gonna reach right here. A little more this way. A little more this way. That way. That way. Yeah. Now, as you can see, it's telling you to twist the handpiece to the right. Right. So twist it like this.
Welcome. My name is Kat Philly and I'm the CEO for the Sunnyvale Chamber of Commerce, and I'm happy and excited to welcome you here this evening. We're excited that we're had the opportunity to have this ribbon cutting, and we have an engaging program ahead for you. Robotic-assisted dental implants.
Thank you all so much for having me here today. It's a pleasure to be here on behalf of State Senator Dr. Aisha Wahab to recognize you all for this incredible accomplishment. Dental implants are a particularly important topic for our office. Last year we ran something called the SMILE Act, which, if it had passed the legislature, would have allowed for more access and more affordable dental implant care for people on Medi-Cal.
Good evening, everyone. Thank you for having me here and my fellow council members here. You know, it's great to celebrate Sunnyvale businesses, especially when we're talking about innovation. So what we're seeing here today, and from a robotic standpoint of implants and try and look at using the new Yomi system is just amazing. You know, so thank you first to inviting us for the tour, but it's a company reinvesting, and this time it's a dental office, and you know, we need all kinds of innovation within Sunnyvale, whether or not that's our tech companies or whether or not that's, you know, family dentistry. It is truly amazing. I just want to thank, you know, the doctor and the owner as far as, you know, being a part of the city for 30 years. This office has been here, but seeing the
Thank you for coming.
She help the clients about financial things and so many things. And I would like to say my best wishes, congratulations, and thank you very much for humankind of the service in city of Sunnyvale. God bless America. Thank you.
Yes. And you are having the scissors.
Enhances the patient experience. So just to kind of read a little information about why we like to utilize Yomi and introduce Yomi as part of the treatment plan for the patient's implant case. It's because the Yomi robot assists dental surgeons like Dr. Gupta in placing implants with greater precision, potentially leading to improved speech and overall quality of life for patients. By guiding the doctor's hand, Yomi reduces the risk of deviations from the treatment plan, which can
avoid areas in the mouth that don't need it. It's going straight to where it is, so healing is actually 80% more accurate than it used to be before. The depth and the position within the jawbone, that this accuracy is crucial for achieving a natural look, which we all want. We don't want to go into an office and get some implants. They don't make it look natural. We want you to look natural and be happy within your own skin after.
Flawless and long-lasting restoration. This translates to the restoration that is only not allow patients to
and with the whole confidence, because now I know I'm doing right way. So it's more precise, more accurate. What I planned, I get it. It's like 100%. So I'm not saying so many post-operative checkup. Why? Because patient doesn't have much pain. They are just taking one day and they are all good. They can return to the work like next day. Just because we are not doing all the traditional way, we don't see a lot of bleeding and we don't see a lot of cutting the tissues. So we are preserving the soft tissues just because of the Yomi. It's like more accuracy and more precise, and we are not using the blade, because when we cut the tissues with the blade, it takes a week to heal. But now I'm just going in right in the bone. We're not doing the sutures, we're not using a thread, and we are not, patients not coming back to cut the threads and having any other issues. So pretty much like I see very smooth transition, because I used to do the traditional way and I used to see a lot of complication. This patient is having a dry socket, patient is having a pain, bleeding for 3 days, but now I don't see much. So it's a good conversion, and I'm very happy with the Yomi. And I'm looking forward to place more implants. I already placed 60 implants with Yomi, so which is really great. And I don't see any complications after placing 60 implants, which is a nice result. And looking forward, we have next week for 5 all-on-X surgeries, which is great. So yeah, thank you so much. And these people work hard. Thank you so much, my team. They really work hard, and they are doing really great. These people work day and night to make this office amazing. And thank you so much, everybody who
Thank you.
Nice. Very nice, guys.
That's probably right. Okay. Yomi, you. Another Yomi. Another Yomi. Are you ready? Ready. Video, okay?